Hey everybody, welcome to another exciting episode of Clinic Gym Radio. I am your host as always, Dr. Josh Satterlee, and it's my pleasure to be joined today by Dr. Keith Yoho. Keith, how are you?
Doing well, man. How's it going over there?
Oh, it's going great. Now, Keith, I was just about to say, coming in all the way live from Scottsdale, Arizona, Grants Pass, Oregon, Colorado, over the last few months, years, over the last year, you've kind of had some ups and downs and moved east, then west, and then west again. And I wanted to cover all that because I think it's an exciting story for people, and I think there's a lot of great nuggets in it for people.
Yeah, for sure, man.
Awesome. So let's give everybody a little background on who you are, what you do. So you are a chiropractor, and I would classify you as a strength coach, but you kind of specialize mostly in more endurance-y people or adult endurance-y people.
Yeah, that's my background was swimming and triathlon. So that's definitely a big passion of mine. And now being a little bit more general practice, there's a lot of the endurance aspects that matter, but it's also the strength components and really what the individual needs.
Nice. Yeah. I mean, in that community and in all sport, basically, there is a minimum level of strength, which I would say that most patients in general don't meet it. And so helping them get there is great. But for those listening, you've been on the podcast before, usually with Nick and Nate Baker, who I know you practice with now. But let's go back early on, and I want to kind of cover the different points in your career and maybe kind of what you learned as you went on. There you were, you graduate chiropractic college, and where do you go?
So I went to Logan for chiro school, and then I had moved back to Houston for my preceptorship, and had an awesome opportunity there. Was planning to stay working with an office in Houston, but West called, and moving out west was one of those things. I was always the direction without a destination, as I like to say. And right at the time that I was getting out of chiropractic school, my brother and sister-in-law had gotten out of the military and moved back to my sister-in-law's hometown in Southern Oregon. So that kind of gave me that landing spot out west that I had kind of always kind of needed to make the jump and move into the mountains.
Awesome. So you move out, and immediately, what do you do for practice? You had finished your internship or your participation there in Texas, and you come out to the West. Do you start your own? Do you join an office? What happened first?
Yeah. So starting out, I didn't really know anyone in this town. I knew three people, and they were all related to me. So I didn't have a big trust of another provider in town. And especially for me, like being in a small town where I don't know people, I didn't know other providers, both professional reputations or their personal reputations around town. And at that time, I was like, honestly, I feel like it's more of a gamble and a bet on what their reputation is, as opposed to just going out and making it happen on my own.
And just for people's knowledge, at the time you moved to Southern Oregon, Grants Pass, Oregon, roughly how big was the city? Because, when I say small town, and I'm from a small town in California, there are 180,000 people in it.
Yeah.
When I lived in Montana, a small town was like 45 people in it, So what are we talking about, a small town?
Right. So as I remember from my original business plan, the town itself was about 35,000. There are two primary zip codes that are closest to town, and both of those were around 35,000. So the county itself is about 85,000 people. So it's a much larger area, but city itself is around 35,000. Daily access to about 70,000 people.
Yeah, so we're not talking about a huge populace. And you were also kind of, as many people who are listening to this podcast are, you're coming out of a hell of an opportunity there in Texas. And so I don't know another term for it. You're kind of a snob about who you practice with or who you kind of got involved with, right? Like you had high expectations for what care should look like, high expectations of how much rehab and how much exercise. And I
Yeah.
guess when you saw most of the chiropractic offices, you were like, no, I'm not interested.
Realistically, when I thought about it, and of chiros that I knew across the country that I would really want to go work under, just knowing them clinically and knowing them personally, and how other people talk about them, maybe 5-10 chiros that I knew of that I was like, oh hell yeah, I would totally just jump and go work with them. None of them were where I wanted to be. So
yeah, well, I think a lot of people get into this like. For example, there's a lot of chiropractors around chiropractic colleges, but is that where you want to be? And are they doing the care you want to do? And then it's like, we know some cats in Boulder, Colorado. Awesome place if you're into endurance athletes. And there, it's super competitive because all the chiros are great at treating endurance sports because most of the population comes in. So,
absolutely.
Yeah. So you open your own place, you open your own office, and then just because this is only an hour podcast, disaster strikes early on. Right. So tell everybody what happens.
Yeah. So one of my buddies was my roommate from Houston was visiting, and we were mountain biking in Mount Ashland, just south of Grants Pass, and wrecked my bike, had full grade 5 AC separation, and hike my bike 2 miles down a steep single track section of trail, and get myself to the hospital. But ultimately, a couple weeks later, had the reconstruction surgery on my shoulder. So it ended up being a good way of ultimately meeting some of the other medical professionals in town.
Yeah, you sacrificed your body for relationships, I guess, huh?
Absolutely.
Now, was this your right arm, left arm?
So it was left side.
Okay. But you could not weight bear on that arm. You couldn't adjust anybody with that arm. You couldn't do soft tissue work on that arm. I don't know if you could do DTRs with that arm for
no.
Right?
Like, I was casted for 2.5 months by the time, I got to surgery and then got through surgery.
So you're about 5 minutes into practice and basically physically you can't do anything.
Yeah. Yeah. So I called up my, my loan officer at the local bank who gave me the loan. And I said, hey man, I know this wasn't in my business plan, but FYI, I have to lay low for a little bit. Granted, I still treated a few patients here and there, between the injury and having surgery. So within that 2-week period, still saw a couple people. And then I went back.
And a desire to be able to afford groceries and stuff,
Yeah, those kinds of things. And then 2 weeks after surgery, I got my stitches out, and then I just went back to practice. And obviously, people would ask if they got a 50% discount, and I was like, no, I have to charge you double. That's not exactly no, but yeah. So I just went back to practice, and you make it work, and it actually ended up being pretty good in some respects because I had to learn how to use my body mechanics in different ways and hone in different skills.
That's awesome. Well, through that, you certainly made lemonade out of lemons. So through that, talk about how you met the Bakers, because it was during this period that you kind of met some of the folks in town, right?
Yeah. So we had followed each other on Instagram or Facebook, something like that. And I had posted some pictures of my x-ray and kind of updating the world on what was going on. And then Nate had shot me a message and was like, dude, what the hell just happened? Like, come over, let's check it out. Let's see what's going on. So that's how I initially met him, was him trying to do some work on a severely separated AC joint. And then not long after the injury and the surgery, I ended up covering for them while they were on their family hunting trip. So that was actually the week that I was getting off my cast. So I was over there super busy for a couple days treating with the sling on, and then got that off actually in the middle of that first week of doing coverage for them.
Wow. And so again, just because of, for sake of time, that coverage that you were doing kind of when you had a busted wing, that led to a great conversation and a great relationship.
Yeah. So I covered for them for a couple of years, hit and miss whenever they were on vacation. And then it got to the point where I was too busy to really be able to do that. And then I was about a year left on my lease on, 600 square foot space, and was starting to look at other opportunities, and other space in town. And that's when they called me saying, "Hey man, we need another chiro. And also we're building a 3,000 square foot gym on the back of our clinic." And really being in this kind of a town, in this environment, like, it made sense for us to actually work together to make this happen rather than try to compete against each other doing a very similar service in the town.
And they were basically building exactly what you wanted. They were just a few years ahead of you, right?
Exactly.
Yeah. So you join up with them, and things are going pretty good. And one thing about you, Keith, is I know that as much as the world tries, your spirit cannot be broken. So you recover fully from your AC separation. And then how long are you with them before COVID hits?
Oh, shoot. That was that a year in? Yeah, I was thinking it was a year in. So, yeah.
So a year in, and you're really getting things dialed in, right? Like you guys have you have multiple providers.
It was 3 months in. It was 3 months in was when COVID really hit, of me being with them. Yeah.
So here you are, just getting what seems like established, right? You're now with a group. They're guys that believe in what you believe, and you believe in these people, and everything's good. And then kablooshka, disaster strikes yet again.
Yeah.
Yeah. And so tell me what you guys decided to do during COVID, because that's when you and I stumbled across paths, was during those webinars we were doing, but also it just happened to be the timing of that seemed to be perfect for you and what you were building.
Yeah, so we had the gym under construction during COVID, and we actually finished and completed the gym like that summer. So it was June, July timeframe was when the gym was being finished. And so we were in the process of going through figuring out all of our gym systems, and I had proposed utilizing CFSC, or Certified Functional Strength Coach, from Mike Boyle's group, as the framework for our training. And fortunately, it was that we took an entire month off just trying to see what the heck's going on. And it was those days just chilling at home where we met on those webinars and worked with Brendan Rierick on a lot of that discussion between the connection between the clinical side and the training side of CFSC. So timing was absolutely perfect on that.
And once again, man, you just have you burn too bright for the world to hold you down. So you basically polish up this diamond of a training program. The facility is just getting done. Your program is just getting done. And the world is just kind of opening back up, if you will. I mean, it never really closed for healthcare providers, but people were a little timid. In my experience, people were a little timid and wasn't super expansive. So when you guys come out of that in the summer of, God, what is that, 2020 into the fall of 2020, what do you start doing? I mean, are you launching basically a totally new program that really hadn't been around?
Yeah, pretty much right in the middle of the pandemic. So it's good timing. And really a lot of it was from a clientele standpoint is just fed by patients who really needed to continue that training. And so for us, it was really a continuation of the medical care that they needed. And so from a legality standpoint, that kind of helped us feel a little bit more comfortable about being able to have some of that as well.
Rehab.
Yeah.
And rehab sometimes.
Yeah, for sure. And the other aspect of it is both of our trainers were former CAs. So they were already, licensed through the Oregon State Board on the medical side of things as well.
Okay. And so you launched this program, and as I understand from the outside, you became kind of the head of the gym team, the gym transition, the middle ground, or you were the person making sure everybody started in the gym. Do I understand that right?
I mean, that was all of us. That took everyone just kind of doing their part and chipping in on different components. And
okay.
Especially we were using a lot of FRS's assessments, functional range assessment, all of that kind of stuff. And Nick really headed up a lot of that component of it. And then I was heading up some of the aspects on the training side and teaching them aspects of CFSC. So all of us had to have a hand in on getting everything ready for that.
Cool. Well, from the time you launched it, when did it feel to you like you guys really had everything going? Like you had members of the gym that were coming there, you had people in transition, you had the CAs were working, doing rehab with people that didn't necessarily require you. How long did that take once you guys launched it?
I'd probably say about 6 months till I was really starting to feel comfortable in that manner.
And just for illustration, so people know, there's Keith, there's Nick Baker, Nate Baker, and then Scott. So you had 4 providers on the clinical side, right, that were all 4 pushing people to the gym, and you also had massage therapy. You have a lot of services there, so I don't want it was a big, healthy clinic before you added the gym.
Absolutely.
Yeah. Awesome. So it takes about 6 months to get up and going, and the world is opening back up. I'm kind of asking for a couple of reasons, but so at that point, if you can think back where you were, you had made the decision when you moved out to Grants Pass to be a solo guy, right? Solo operator. And here you were with a group. That worked. And then the group decides to expand its services into offering the clinic gym hybrid. Do you remember what you were thinking then, or were you just so caught up in all the work that had to be done, like you never really took a chance to look backward and go, man, I've come so far?
That's always a struggle because you have like specific goals and things you want to accomplish.
Yeah.
The destination is always there, and then it keeps just moving. The horizon keeps moving as you move, and you don't really look back as much on that. And that's something that we're starting to do better with some business implementation and some data collection and all of that. That really is kind of helping us be able to look at our numbers and look at growth and being able to appreciate what we've actually accomplished.
Okay. Was there a moment there where you remember sitting back? I mean, for our listeners too, I don't know at what point your brother opened up the brewery, but Keith's brother has a brewery there in Grants Pass, which is heartbreaking, a bunch of picnic tables and really good people and beautiful summer nights. I don't know if that accelerated your clinical growth or tamed it. I'm not really sure. It could serve both roles.
No, it was a huge assistance, man. Like I was just there the other day and ran into 4 patients, at least 4 or 5 patients.
Yeah.
Saw a couple others that I did talk to, and then actually the surgeon that did my shoulder, he was over there hanging out with his family too. So
that's awesome.
That's one of the big perks about being in a small town is being able to see and grow and develop those relationships.
Yeah. Well, was there a time when you look back and you were like, holy crap, I've come so far since that little tiny 600 square foot office?
Yeah. I mean, every day you kind of, especially now, like you definitely things aren't the same as they used to be. And it's not just like from a space standpoint and a perspective standpoint, it's how much I can actually focus on my craft because I'm not the one calling all of the work comp insurances. Because that was really one of the big things that helped me grow my practice initially. I'm not the one doing all the insurance verifications, answering all the phones. So it's the factor of like being able to focus on my craft and what I can't be replaced with. That's one of the bigger reminders is the focus side of it, not necessarily the space.
That's awesome. So you're with a group that you totally dig. You guys have this program going, and I'm just jumping ahead. You guys have so much going on, right? There's I can't remember how many. Let's say in January of this year, right? You're out of the pandemic. Things are bumping along. Maybe later than that. Maybe July of this year. Things are cruising along, and there's almost too much going on, right? Like you have all these people, all these initiatives, all these goals, all these things, and you guys decide to undertake a big organizational kind of meeting, right? And you grab the EOS system. Can you tell us a little bit about, like, well, number one, for those who don't know, what is EOS? And then secondly, when that was brought up, what were your first thoughts and what was your first experience going through it?
So EOS stands for Entrepreneurial Operating System. EOS Worldwide is really the name of the company. It was founded, and the Traction book and the other ancillary books are written by a guy named Gino Wickman. And really, they go through a ton of things that help to organize and focus your company, help to create the vision, help to create your the characteristics of your business. And really from there, okay, we look at our 10-year visions, and then you can look at 3-year goals. And then from that, being able to break it down into, okay, if we're going to accomplish these goals, actually creating our quarterly rocks, the things that we need to focus on right here, right now, so that we can meet our 1-year, 3-year, 10-year goals. And that just provides so much clarity. And then it also provides a ton of clarity because we actually went through and created a more distinct organizational chart, and really focusing on everyone's roles and responsibilities. So when something comes up that needs to get handled that we don't want to get done, I mean, it doesn't matter. Like, it's this person's job, like that falls under your roles and responsibilities. So some of these aspects just really help with the accountability and ultimately helping to move the business forward.
So I know there was talk of that. Did you decide to move while that talk was going on, or was that talk of that organization after you had come back?
I had decided to move down to Arizona in January of this year. And then this was in July, that all this end of July when all of this was starting to go on.
So you had already made the decision you wanted to move to Arizona, kind of got things in line, and obviously it was a transition out over a few months, right?
Yeah. So March was when I headed out to Arizona.
Yeah. Now, for those people listening, so there you are, you're with a great group of people. And I think one of the greatest things about chiropractic, you know, and certainly Clinic Gym Hybrid, is if you have your brain and you have your hands, you could set up anywhere, right? I mean, if you have a table, you could set up in a truck stop or at a race or in a gym or have your own, right? It's not like a dentist where the amount of equipment is like so cumbersome that it would take you a long time to build an office. But was it that you had kind of felt like you were losing your independence, or what was it what was the big driver to move down to Arizona where you didn't have a network, you know, your brother didn't own a brew pub? I mean, I got to go back to that. Like, why would you leave a town where your brother owns a liquor store, a bar, a restaurant, or you know, a brew pub? What really motivated that move?
Drinking too much of the product and getting fat. No, it was, it's really just aspects of idealism, and the guys here at the office are super gracious, and the fact that they recognize, oh, hey, you know, he's already a business owner. And one of the aspects of me coming on was like, I didn't really want to come on if there wasn't an option for me to become a business owner again. So I was reaching to that point where we were approaching ownership conversations. And then there were aspects of why I became a chiropractor in the first place that had really reared up, and I didn't feel like I was able to fully commit to them at that time. And I needed to go and go really figure out exactly what I want to accomplish with the profession, with the career, and how I need to organize that. And I needed a full separation from here, and I needed to go struggle to help me figure that out.
Do you mind if we dive into that a little bit? Because I think your story...
That's the perfect pun. Diving into it.
I think your story is very similar to a lot of people. Like, I think there are a lot of people who, you know, you see it right now. I'll give you an extreme example. I just met this cat that got out of school, started working for the Joint because he needed to make money right now.
Yeah.
And so he's 3 years in, and it's nothing like what he wants to do. And so now he's at the point of like, hey, should I keep doing this? Basically, every day I do it, my candle burns a little dimmer, you know, and it's, but my paycheck grows a little bigger. And if I go to do it on my own, I'm going to make less money for 2 or 3 years, maybe forever, but I'm not doing the kind of care I want to do. You were not an extreme example, right? These guys like Nick and Nate deliver care similarly to what you believe in. I mean, everybody's different, right?
Yeah.
But DNS principles weren't off. They didn't twerk their eyes at that, right? MPI adjusting, they were like, yeah, we're down. The SFMA, they're certainly believers, right? Everybody gets exercise, everybody gets rehab, yet you still felt that pull. Can you tell us a little bit about that?
Yeah. So I came into chiropractic because of my own injuries. So I was a nationally ranked swimmer growing up, started off swimming college at a top 10 D1 program. And then I had some of my own shoulder injuries and really wasn't getting the care that I needed. And ultimately ended up leaving, moving back to Texas, to where my chiropractor was, where my family was, and also where one of the top triathlon coaches in the country was located. And I went into triathlon. So I was racing triathlon, getting my shoulders healthy. And within a year of racing triathlon, I qualified to be an actual pro status and was doing Olympic distance and draft legal style racing. And at that point, I was having other injuries. So it was shin splints kept rearing up, and I could run a 36-minute 10K off of a bike with hardly any training, but I could never get to where I could really run more than 15 miles a week. So essentially, these health issues had derailed two very high probable, high contingent careers for me, athletic careers. And I fell into coaching at Texas A&M. So I coached for 2 years with the women's swim team. We had 6 athletes that went off to compete at the Olympics while I was there. That was the London Olympics at the time. And 2 of them were like super close friends that I grew up swimming in the same lane with as juniors. So yeah, it was that. And I loved coaching, but I left frustrated almost every day because these cues and these drills can improve the technique of 80% of the girls. But then 20% of them, like, we needed to dive in further. And I already had a big influence of SFMA and 4x4 matrix and all of that kind of good stuff. And joint by joint approach from my mentor back in Houston. And so I was already starting to implement some of those principles and implementing some corrective exercises for them, seeing good success. But I knew I would not last as a coach with that daily frustration and just not having the knowledge that I really wanted.
Yeah, man, I can remember a moment. I was a student trainer for women's basketball team at my university, and 2 experiences that I say were a large influence on my chiropractic or pursuing chiropractic. For one, I remember this girl we had low back pain, and looking back, it was like exquisitely facetogenic, single side facet pain. And her back was killing her in a game. And every time she ran, she just dumped into like anterior tilt, right? She landed hard on a rebound on her right leg, and it was right-sided facet pain, and it just sent her through the roof. I mean, you never seen somebody in so much pain. And then we had to fly back that night from Portland, Oregon to Salt Lake City, then up to Bozeman, Montana. And seeing her, this girl that could play, high-level basketball, was like shifted onto her left cheek. She's crying the entire flight both times. I mean, she never stopped crying. She was in so much pain. And they were like, oh, we're going to do an injection, this and that. And I just remember like thinking, God damn it, there's nothing else we can do for this person. Like, there's nothing else. Like, the trainers were like, I'm sorry, just got to ice it. Her skin was blue from ice, she couldn't ice it anymore. And they didn't have anything to give her any relief. The team trainer, he was an experienced guy. He was like 4 or 5 years into being a paid staff trainer, and had no tools. And then I remember another girl had this horrible foot pain, and same thing. We just couldn't do anything. We taped it. She got injections in the, what's that called? Intermetatarsal space or whatever, in between the bones. They were doing injections like at halftime and shit. It was like Varsity Blues looking stuff. And again, I just thought, like, this is it. White tape and ice and a needle. That's our tool set. It was so frustrating. And so when I saw chiropractor with my dad. My dad was going through a battle with brain cancer, but my dad would go in and that guy would actually do stuff like, hey, I'm going to do something right now and it's going to make you better right now, not 4 to 6 weeks from now, not let's get an x-ray or MRI first. It was like, let's do something right now and get you out of pain. It wasn't a panacea. It didn't relieve 100% of his pain, but damn it, it worked now with what the guy had. And I was just like, God dang, this is so much better than everything else I'm seeing. And those two experiences drove me there. So I can only imagine what it was like for you of well, I could take these girls to the next level only if we could get over this, unlock this door, or only if they were willing, or somebody would just grab the reins here and say, like, you need rehab, damn it. You don't need another 5,000 meters in the pool today.
Yeah, absolutely. I think at my peak, we were swimming around 55 miles in a week, which is a lot.
Yeah.
So,
yeah. I mean, the definition of overuse injuries, right? Like,
right. Yeah.
Yeah. Just the incidents. So that's what took you into chiropractic, right? So knowing that, feeling that, what pulled you out of
yeah. So
what made you pull the desire to make you want to move to Arizona?
So a lot of it was factors of, really when I went into school, I didn't know where I was going to find answers. I knew it was going to open up doors and avenues to be able to understand things better. DNS was really the thing that made a ton of sense to me and really helped me to understand how the body works, especially from a swimming standpoint.
Where did you first encounter that in your journey?
With Brett Winchester was an influence, obviously, at Logan. And then,
so you're already at Logan when you discovered that?
Yeah.
And it just kind of clicked?
I never heard of it until then. I talked to some other guys who were upper tries and that had talked well about it. And then so I just went off and took DNSA. I think it might have been my first trimester in my first trimester. And just started going from there. And
so you learn really this thing and you're like, this solves all those things I was looking for an answer
to. First time I saw them put up a picture of the 3-month prone position where you're laying on your belly with your elbows in line with your ears and your arms above your shoulders. I was like, that is butterfly. Tell me the mechanics of this position. And then like that right there helped me understand so much more. 4.5 months is very similar to aspects of freestyle. And then it all explains why breaststroke is so weird. So for me, it was really a great tool for me to understand how the body worked and how I would go to those kind of courses and then I would come home from on a Friday night. And there were times where I'd be sitting at my dining table by myself, like remembering athletes and what their technique flaws were. And then I'm like, okay, well, these would be the things I would expect to see on exam findings or functional assessments. And then like, hey, here's the on hands treatment I would do. Here's the rehab progression I would do. Here's the strength and conditioning progression I would do. And then here's like drills that I would just make up in my head as far as how we could carry that into the sport. So that was really the big driver for me getting into school. And being in the small town, we have a swim team here. It's not super developed. And when I was first moving to town, there were times where I tried to communicate with some of the different coaches and it just wasn't really getting there. And I was talking to Brett Winchester last December about a lot of this during a DNSC course that he was hosting in Troy, Missouri. And I would be like, yeah, hey man, this explains so much about this aspect of swimming and other aspects of swimming. And for me, like I know at some point I needed to get back to that and have some aspect of why I initially, became a chiropractor in the first place. I couldn't really make that happen here, but I could call up, buddies at 6 different programs that are coaching at, 6 different top 25 D1 programs. So there was a lot of that kind of frustration that led me to wanting to move. And the big thing for me was that I just could not commit to, at that time, to, a partnership type of agreement with my brothers and Nick and Nate and Scott. and without working through that and feeling like, okay, I'm 100% on board. So it wasn't really like I didn't really feel like it was that much of an option for me to stay without going off and doing a little bit of this.
Do you think that part of that was, here you guys were, I mean, you'd come back from a major injury, you hooked up with the right people, and you're just on a skyrocket to the moon, right? Everything's kind of lining up perfectly. Everything's going well. And did it start out as a seed of like, man, I really wonder if I could go back to that. I really wonder if all this success, if I took what I learned and what I've been through and applied it, that I could finally solve that thing that ate at me for so long.
Yeah, absolutely. 100%.
And so let's go through that journey. So I remember talking to you. I saw you at you guys hosted an SFMA, which was kind of like your farewell weekend, right?
Oh no, I was
already
back in town that weekend. I had already been gone for a couple of months. Okay. And I had flown back for a funeral.
You were loading up a U-Haul though. I remember there was something with a U-Haul, right?
Yeah. So I was back for a funeral and yeah, so we were loading up the U-Haul to take the rest of my stuff down.
Okay. Cool. So yeah, because all right.
Yeah,
so
my move was whatever could fit in the truck went with me. Whatever didn't.
This is like living life out of a bag and a sleeping pad on the ground and the old milk crate with a lamp on it, right? Like
it was a little better than that. One of my patients here in Grants Pass, I ended up moving in with her sister had an extra room, so it was like, oh hey, family friend type situation.
So it didn't look like full on human trafficking coyote style, but
I had roommates. I had a bed to sleep on most nights.
Okay.
So, yeah.
Cool. All right. Well, so you moved down to Arizona and how to go and what happened?
I mean, it was good, man. Like I honestly don't have anything negative to say about the experience other than it cost money. Okay. But that's also aspects of growing, and like I needed that. Really, some respects I feel like I needed a sabbatical more than I needed a full move. But really, that full move is and the challenges of going back from a solo practitioner to being a practitioner in a group, back to being a solo practitioner. A lot of it was great. I had to go out there and put myself out there. I was getting in with a bunch of triathletes, good coaches, really good athletes, swim team. Some of my first, clients were all Ironman triathletes, coaches at, one of the top swim programs in the country. So everything was really moving in a great trajectory. But there's the aspects of trying to figure out exactly what you need from your career, exactly what you need from your personal life, your family, everything else like that, that really comes into play. And actually one of the really big factors was when we were in Dallas for the initial clinic gym hybrid course. And, we're hanging out with, the DMAX, Cody and Marianne, and we're talking to them about like, hey, they have like close to 300 students that are onboarding this semester. And then part of me is like, wow, what are we doing to actually be able to create jobs for chiropractors, particularly like good jobs? They're like, how are we able to offboard all of those students from school into good, ethical, quality paying jobs? And so there's aspects of like, okay, for myself, what I want to do for the swimming community, what I want to do for the chiropractic profession, all of that stuff, it complicates things. And also what I need to do for my family. It's like like for me, I don't have a wife, I don't have kids, I don't have any of that, but I do have my brother has my 3-year-old nephew and my 1-year-old niece. And then my sister-in-law's dad is the one who had passed away. And that's why I was back in town that same weekend as the SFMA course. And really the more time that I spent in Arizona, it was like for me to accomplish exactly what I want to do here, right now it would probably take me 10 to 15 years to do exactly what I want to accomplish. And I'm not at a point where I'm willing to sacrifice that kind of time.
You're saying if you were on your own, it would take 10 to 15 years?
Not from a business standpoint, but from like an idealistic standpoint where I can take all of these different things that I've learned from the treatment world, really build the relationships in the swimming world to where I'm having the results and having the outcomes. And then from that, being able to do the education side of it and really trying to bring in practitioners and coaches and everything that, like, taking all of this knowledge and giving it to that world. Absolutely. It would take a long time to make all of that happen.
So
and
what's your thought on that timeline, hooking up with the guys you're hooked up with now?
So yeah, there are aspects of my family was really more of a priority. Like I didn't want to give up being around my niece and nephew for the first 10 or 15 years of their lives. And then, you know, my parents aren't getting younger. I'm not getting younger. Like, I want to be around for all of that. And let's be honest, dude, I freaking miss trees. Trees are awesome. And we have a lot of those here in Oregon.
Well, you kind of also moved to Phoenix in like the absolute worst freaking time, right? The dog days of summer.
Yeah, for sure. It was hot, you know, having to walk my dog at midnight just so it was only 102 degrees out wasn't great. But no, there's a lot of beautiful things about being here, and it's really ironic because about 3 weeks into being back, I got a phone call from the new coach at the high school, and about trying to help them with their dryland programs. And
for
so
swimming, the new swim coach at the high school.
Swimming. Yeah, so I'm going to be doing all the programming for the high school swim team, doing coaching with them both in the water and drylands, and actually being able to make some of that kind of stuff happen here.
So, so
somehow they open.
I know. I want to dive into that. So there you are. As you said, you kind of took half of a sabbatical, half of a professional, whatever, opportunity. And as the world often works, you got exactly what you wanted. Exactly. And sometimes it's like, well, I don't know if that's actually what I wanted, but God served it. You asked for it, God served it to you, and it was like, wow, that's not anything like what I thought. Or it's exactly what I thought, but just not what I really wanted. So you come back to Grants Pass, or Nick and Nate say, hey, man, yet again, we need another doctor. We want to put the offer out to you.
Well, no, not exactly. Well, so it was interesting because so me leaving, it was like, okay, well, we have to find a replacement for Keith. And then that brought in more of the old relationships, like with Dr. Aaron Montgomery up in Portland, who is a clinical site for WS, Western States, and talking to him about, you know, getting in with preceptors, and we found a fantastic preceptor who's all ready and set to take over my my time slots. And now they were starting the EOS process and figuring out kind of what we want to do for growth. And it comes back to a lot of what I was talking about with, you know, Cody and Marianne. Like, I want us to be able to create good chiros, and I don't necessarily want to go do that on a weekend basis. I want to actually be there for their development. So working on developing a preceptor program, working on adding in new locations. So we're planning to have another location here within the next year and a half down in Medford. That is a larger facility than we have right now, and offering both, you know, not just chiro and training in the gym side, but having physical therapy. We added on our first physical therapist while I was gone as well. And then having our massage, all of those components working together, and really trying to do better things for the development of chiros.
And so you came back and you were sharing some numbers with me, but with, I don't know if it's newfound clarity, I don't know what it is, but it took you a while to fill your schedule before, and now it seems like, and I'm exaggerating a little bit, I know you were fill in as quick as you could before, but basically when you came back this time, it almost filled up all the way immediately.
Yeah, it's crazy. I mean, I started seeing the first couple of patients August 22nd. And then I was basically 3 weeks in, busy as not as busy as I totally was, but then now the last 2.5, 3 weeks, I'm busier than I ever was before I left. So less than a month in, and I'm already ahead of where I was when I left.
What? I mean, when you look at that, why do you think that is? Because there's a lot of folks listening that want to have a fuller schedule. Do you think it's you just took the brakes off yourself? I mean, I deal with that, like that kind of whatever you want to call it, imposter syndrome or fear or nervousness. So is it that? Is it reestablishing relationships or remembering old relationships you have? I mean, we all establish relationships and then at some point lose touch with those people, right?
Yeah.
But what do you think it was?
Well, it's hard to say exactly what it was, because even after I left, like something happened to where the business just started going bonkers. Our referrals were even increasing to where there were days where we'd have, 8 to 10 medical referrals that would show up in one day. And that's not uncommon for us now. And seeing, I think last week we had like 31 new patients. I had 12 new patients. I think it was 12 new patients last week. So it's
did personally, and the
myself personally.
entire facility had 31 last week.
I think it was 31, something low 30s last week. Yeah. It was super busy. A lot of it's just building those relationships, especially from a medical referral side. Building those relationships, not being scared to put yourself out there, and actually just making those phone calls. If you think that there might be something to talk to a provider about, call them. Especially if you don't know them, call them. If you want to learn more from an ortho, call them and get scheduled. Like my ortho here in town who did my shoulder, he did his residency at Mayo Clinic. So before I went down there, I already had contact info for the head of Mayo Clinic, and I was shadowing the head of Mayo Clinic, head orthopedic surgeon
in Scottsdale.
Yeah, in Scottsdale. So making those connections, certain providers were happy I was back. So that just kind of brings you to top of mind. Some of my patients found out I was back, and so they also had some rescheduling and some new activations. So it's just busy as can be.
And so
do good work, and like actually communicate with other providers, ask for referrals from your current patients, and you can build a very busy practice.
Yeah. So as you look at it, you had a start with this 600 square foot place. Then you had to start as essentially as a staff doctor. I don't know what to call it, right? Like, I don't want to say associate, but a staff doctor or whatever. And then you had a chance to grow on your own. Then you came back again as a, looking back, if you're talking to somebody and they're coming out of school, Aaron or the DMACs are sending somebody, they're graduating. Can you distill it down to 1, 2, or 3 things that you're like, here are the things that I know worked every one of those times?
The number one thing is authenticity. I spent like 6-8 months in practice trying to be this super professional person when I'm like a pretty laid back guy. And like to where it was almost a little bit stiff. And then once I started actually relaxing and being more personable, might have dropped a cuss word here or there for the right patients. And then like, it's amazing how you can actually just be a human. The beautiful thing about that is like, if you can joke around and you have that personality where you can joke around, have a good time with your patients, that builds rapport with them. But even more than that, from a clinical standpoint, now I have something to work off of. If I need to be serious and I change my tone, now I can get them to actually pay attention to me. If I'm being serious all the time, they don't take the serious stuff seriously. If I can be fun and joking, now I can actually change my tone. I can be serious. I can act serious because it's not the same thing that I'm always sounding like. That was one of the biggest things for me, was getting that down. And then from a clinical standpoint, I was listening to your interview with Brett Winchester last week, and
Mark King.
Well, I was listening to that one too. That guy's stuff too. But on Brett's, like, it's his playbook of the toolbox with, okay, you got to master your MPI, you've got to master your MDT. Like, those are things that I use on almost every single patient. And then, like, the DNS helps a ton. The SFMA helps a ton. The neurodynamic solutions helps a ton. But, like, if you can pick one of those things and get really freaking good at it, and then start adding on the next thing and figure out how to create the toolbox that works for you, is huge. So that would be my second thing. The third thing is send your notes from all your evals to every single primary care provider you can. Make them look good, make them look professional, get that done. Let them know that you're there and that you're able to actually help. That is the biggest thing. And if you can't get into a primary care office, like, I had a primary care office in town that they wouldn't let me talk to providers unless the provider reached out. So, and they didn't know I existed. So I said, screw it. I just made my primary care provider a doc at that office. So you have to find your ways and be creative to get in front of people and create those relationships.
Yeah, I think you're reminding me of something. If you're a young doc out there, or hell, if you're, no matter how old you are, you'll be surprised at how many surgeons, pain management, primary care, radiologists will let you shadow for a day or half a day, and it's it works great for everybody because, they might not trust you, or they might not know you enough to trust you, and you might not know them enough to trust them. And when you guys spend a few hours together, many times it gets past the minimum necessary trust that's there, and moves into something of, once they do have that relationship with you, you probably get their cell phone number. You can probably send them a couple people, and they can maybe send you a couple people. And, like you're saying, you send the notes, they know the context of the person sending the notes, not just, oh, these are the same notes generated by whatever, Chiro Touch as everybody else.
Yeah. And the other big thing to me is, like, don't just reach out to, I think reaching out to the specialist is huge. Just don't reach out to them expecting to have a bunch of referrals either. Like, reach out to them because you need to know how the hell to manage a case. If I have someone who comes in and they're clearly, a chemical sensitivity person, they're not responding to mechanical stuff. I can do a ton of things to piss it off, but nothing to provide any relief. Well, I need to have my urgent care that I know can, like, oh, hey, this person's been chewing up 1,200 milligrams of ibuprofen. I don't want to send them to someone who's just going to give them an 800 milligram ibuprofen. Like, I want to know where can they go to actually get a steroid that can help us address that. Yeah. Okay, cool. And now I have a reason to go talk to that urgent care. Now, okay, well, if that doesn't work, what happens? You may need an injection. Well, you need to go meet those people for that exact reason. Same thing with the spine surgeon. So all of that kind of stuff. And that's actually how one of the big things that blew up my practice was, like, I had a patient I was co-managing, and he was being referred by his primary to the spine surgeon, which totally agreed it was time for that. And so I called up the neurosurgical office, and I said, hey, I am co-managing this patient who with the primary care, and I don't know any of the docs at this office, and I don't feel comfortable with my patients being referred places that I don't know any of the providers. This was 3-4 months into practice, not long after I got my sling off. And they go, yeah, well, we can definitely schedule that, but by the way, we also, they're actually hosting an event next Thursday at a winery. If you want to come for dinner, there'll be about 40 primary cares at that dinner. So I was like, hell yeah, I drink wine. Let's go. So,
let me check my schedule to just make sure that's
my schedule just cleared up.
Yeah, that's funny.
So, yeah. So I go down to that event and then end up sitting next to the head of the work comp clinic, both in our town and in Medford, the bigger town, about 25, 30 minutes away. And he's like, wait, so you're a chiro, but you actually do rehab and all of that kind of stuff? And I was like, yeah, dude, that's exactly what I do. It's like, well, sweet. I'm going to load you up because I have, certain points in time where like I have a patient who's not responding to physical therapy, but they're not at the point where they really need more aggressive interventions. And if I say, okay, we're going to try something new and we're going to try chiro instead of PT, then the insurance companies will approve of that. So then, there were times where I was complete solo practice and I had 10 or 12 new patients and 6 or 7 of them were work comp that week. And my biller was like, dude, you have more work comp and all this stuff than any of my clients who have 6 or 7 providers. I have no idea how you're doing this, but it's like you're providing.
You're like, I drank a lot of wine. That's the key. I need to drink a lot of wine on somebody else's tab and they just come.
Exactly. Yeah. Yeah. So those are the gigs to figure out how to get, because it's a good gig to build your practice off of a bottle of wine.
Yeah, absolutely. That's why I golf. Like,
yeah, for sure.
I think it wouldn't be a bad investment if you're like within the first 5 years of your practice, go join a country club and play every Thursday and every Saturday. You'll be amazed at what happens after a year. But
right. Yeah.
Awesome. Well, Keith, this has been a heck of an hour. I really appreciate your time. Last thing, once again, I think that one of the amazing things about you, you're incredibly smart. So for those if you attend a live event, one of our Clinic Gym Hybrid live events, Keith was monumental in helping put together the flow of the exercise labs and the order of them and the organization of it. I'll tip my cap to you. Like, it would not be as great and wouldn't go as smooth without your help there. So I really appreciate that. For those, one thing about Keith is he's pretty mild mannered, but the guy has an uncrushable spirit. You're always finding the humor in things. You're always finding the positives in things. And I think it's great. What has allowed you to do that? Is there any tips you have for people if they're in a tough spot or something? You always seem to be finding people to hang out with and things to do and activities to do. How do you keep that spirit and that candle burning so bright and maintain that authenticity?
Yeah, it's a balance of a lot of different things. I think I'm a very social guy, so having my different friend groups is really important. Ones that are clinically minded. And
when we're at your brother's brew pub, Nate and Nick Baker said, "Oh God, he's like the mayor of this town." You knew everybody there.
Yeah, I know a lot of people, but that's the thing though. Like, Nick and Nate also came into an office that was already established. Like, for me, I had to, like, in this town, I had to go out and meet everyone I possibly could. And so that's a big component of it from a practice standpoint, but also for me as a person, I like to be social, but I'm also in an area where I can piece off and go for an entire weekend and be in the mountains and not see another human. So for me, being able to have both of those is huge. Or if I need to have like 1 or 2 buddies that we just go and get back on our mountain bikes like we did last weekend and go crush the same trail that I went and crashed on. And I think a lot of it though, man, it does come back to my athletics background and like learning how to struggle. You have to learn how to struggle. Waking up and jumping in, like when I was in Minnesota, biking directly north at 5 a.m. to go jump in cold water. Like that was a mental struggle that I don't really wish on anyone. But like learning how to struggle, you have to figure out how to persevere. Whatever it is for you, you have to figure that out. Family has been great to have that as also, a distraction from some of the struggles, and just to know that there's that support network that's there.
So basically, you always bet on yourself. If it's going to be a struggle, you're like, I'll bet on myself surviving this. If you're going to set something up, you'll bet on yourself, or go to meet the doctors, you'll bet on yourself, and it's worked out this far.
I don't know why someone would bet on themselves to fail. That seems counterproductive.
Yeah, well, people have self-doubt, I have self-doubt sometimes. So
absolutely. We all have that, but at the end of the day, you don't go all in on that bet. You go all in on the bet on yourself. And it's way easier to do that when you're like, oh, hey, I'm in a group where I'm not just betting on myself, I'm betting on my team. That's huge.
Yeah, I think that is. All right, well, I'm excited for what you guys are putting together up there in Oregon, and I think it's going to be the best cluster of both treatment, clinic, gym, and training facility for young doctors. So that's exciting. Can you share your contact information with everybody in case they want to reach out, or especially if they're a young doc who will be graduating soon? I think it's worth reaching out, but can you share your contact?
Yeah, absolutely. My email is dr.keithyoho. So that's spelled Keith. Last name is Yoho. And that is at totalperformance.clinic. So dr.keithyoho@totalperformance.clinic. You can also find me on Instagram at dr.keithyoho. And the office is totalperformance.clinic on Instagram as well.
Cool. And it's there in Grants Pass, Oregon, home of Total Performance Healthcare and Dutch Bros Coffee.
It is.
Yeah, we'll see which one's the biggest in a few years. And what?
Weekend Beer Company. Sweet.
Awesome. All right, Keith. Well, thank you so much for the time. Congratulations on all the success and on the path. I'm excited to see where the story goes, brother.
Yeah, thanks, sir.
All right, I'll see you soon. Actually, I'll see you out in Portland soon, huh?
Yep, SFMA. Here we go.
All right.
Fourth time.
All right. Yeah. 18th time for you or something like that. Well, for everybody listening, as I always say, I think Keith's a good example, but go out there, maximize your license, and live the life you dream of. Thanks so much, Keith.
Yeah, man.
Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.